Good afternoon. This is Dr. Lewerenz, Longevity Health Institute. So, if you're a man, you're over 50 or close to 50, and you have concerns at all about erections, and you have concerns at all about how much you get up at night and pee, or when you go to the bathroom, your flow isn't as good as it could be, or if you're the wife or spouse or partner of someone like this, you may want to listen. So again, this is Dr. Lewerenz, Longevity Health Institute. I'm going to go over something that deals with what we do here with prostate health and prostate prevention and proactivity, but some things to cover importantly and briefly. One is after the age about 45, studies show, and sometimes earlier, men's prostates start to enlarge. And as they enlarge, of course, we start to get some urinary symptomology or erectile symptomology, and unfortunately, and thank Godfully, infrequently, some prostate type of infections. But as the prostate gland swells or grows, and this is what you urinate through, you could have some symptoms of erectile dysfunction. You could have some symptoms of urinary flow issues, and those can vary. Those could be varying from not a strong stream to a stop and go type of urinary flow, to emptying your bladder and then feeling 30 minutes or an hour later that you have to empty your bladder again. So again, these are very common, 45 and on, definitely in your 50s and 60s, it's going to happen. Usually it's something that has to be monitored, and the studies have now reported over and over now that the best way to monitor this, the most effective and efficacious way, is really just clinically, personally talking to the patient, but also looking at their PSA. And really what we do with a PSA is it's a blood draw, the prostate specific antigen. There's a super sensitive one that we use in the blood, but basically we're looking at the prostate escalation. So not necessarily what the prostate or PSA number is, but how it escalates. So if it escalates quickly, we get a little bit more concerned, especially concerned in the cancer end of prostate health. But it's so common. In fact, I just had a patient this morning ask me, well, is this abnormal? He is like 62. Is this abnormal? Because we had to actually do an ultrasound. The ultrasound showed that his prostate size was kind of big. He had a few calcifications in his prostate, but really from a cancer perspective, he was good. But his PSA has done this up and then down and then up and then down and all that. But clinically, he has good flow, and he's not experiencing a lot of symptoms. So we're monitoring him, we're watching him. A couple key things is this. On the natural end, you can do some things to prevent prostate growth and hypertrophy. We call it BPH, benign prostatic hypertrophy. And that is taking supplements and some natural things, which we carry here in our practice. We have it on our website through our warehouse that can be shipped to you. But things that protect prostate and help prostate volume stay in control and help urine flow, but also prevent prostate cancer. Okay. So a couple things. One is saw palmetto, well known, an herb, very good for prostate health, documented. Another one called diindolylmethane, DIM, is very good. Another extract that's called indo-3-carbinol, IC3, very good for prostate health. There's some benefits too to your other herbs and medicinal things in mushrooms. Nettle can be helpful. In anything that potentially can block the hormone, or limit, I shouldn't say block, but limit the hormone called dihydrotestosterone. You need dihydrotestosterone, it's good for you, but you don't want it high. What happens a little bit with aging is we take our own testosterone through our liver, we convert it to dihydrotestosterone, and then the prostate gland swells. And again, this is not here and there, this is actually everybody if you're blessed to live long enough. If you live in your 50s and 60s, it's going to happen. And then it's just clinically, how often are you peeing at night? How much is this a bother? What's my stream like? How should I seek attention? Here, we're always proactive. We want to talk about this. We want to assess your PSA, talk about clinically where you're at. Occasionally, we do ultrasounds. We look at the PSA escalation, and in some cases we do genetic testing to actually see what somebody's risk is. If you have a higher risk of prostate cancer in your genetics, and genetics actually only express a very small percentage of cancers, but we do want to consider that, okay? Negative things in the medical world that can bother you, or I should say the everyday world. What bothers your prostate? High testosterone can bother your prostate, and more specifically, high dihydrotestosterone can bother your prostate. The other thing is alcohol. Alcohol can be an irritant to the prostate, make the prostate gland swell. Hypercalcemia. Hypercalcemia in your blood from your parathyroid hormone or from other reasons that you might be hypercalcemic. And with aging, we do actually develop more calcium in our body and in our blood. When you get hypercalcemia, you can calcify your prostate, and those calcifications do not go away. So meaning they're not going to fluctuate in prostate size. They're going to make your prostate solid, harder, bigger, and then etc. grow. So calcifications can be an issue, and you have to be watched for that and make sure, and we have ways to reduce your hypercalcemia risk. The other thing is medications. You have to be careful with some medications because some medications can make your prostate gland swell. One of them is some things like over-the-counter like Sudafed and ephedrins and things that actually tend to cause volume issues or expansion of the prostate. They're temporary, but you need to be aware of that. The other ones, medication-wise, that actually potentially could aggravate your prostate are some of the beta agonists or inhaled medications that you might be using with COPD or lung issues or asthma. So just be aware of that. The other thing is when you have a practitioner and you're having a good practitioner watch you personally, functionally, make sure, this is super key, that if you're on a medicine that is helping your prostate health, it's not mimicking or hiding prostate cancer. And there's studies on this. So there's a medication called Avodart, Tamoxifen, or Tamoxifen, I think is how you pronounce it. Tamoxifen, I think that's more it. Tamoxifen. Sorry about that. But Avodart is a medication that does block dihydrotestosterone and has some nice effects, and you might have better flow. But here's the issue: is it often then will limit your PSA antigen. So we do your blood tests and they never go up, but we could be hiding then and harboring a prostate cancer that we're detecting much later in life. That means it's much more aggressive. So you've got to be careful and be watched. Often what we do if somebody's going to be on that medication, we try to, or if we're going to use it, which is rare, but if we use it, we want to make sure we get a PSA and understand that that's the baseline PSA prior to any treatment. So that's where we're looking at. And it literally any minor adjustments, we need to look into their prostate with an ultrasound or further detection, or refer them out to some of our excellent urologists that we use. So that's something that's very, very key and very important to be aware of. Other than that, your diet, obviously your fruits and vegetables and your lycopenes and things like this are very influential on your prostate health. Anything that's going to reduce inflammation in your body. You hear me talk about this all the time. So we always look at your systems, that you're not producing inflammation in your body. You're actually then going to have less inflammation of the prostate. The whole idea is vigilant watching of your prostate with aging, especially at the age of 50 and for sure into your 60s. Sadly, studies have been done on cadavers. You live beyond 80, your risks of prostate cancer beyond 80 are nearly 100%. They've done biopsies on cadavers over the age of 80, and nearly 100% of them had prostate cancer cells present. Did that kill them? No. But it's something that we know that's coming, and you want to prevent, delay, and mitigate any type of early effect in your life in your 50s or 60s, obviously your 70s. So I hope this finds you well. I hope this enlightens you a bit. Share it with loved ones or others, or if you're the spouse of a partner that's up all night peeing or having erectile issues, this can be very helpful. So Again, this is Dr. Lewerenz, Longevity Health Institute, always educating you and bringing you the best of personalized functional medicine. Have a great day.